Wednesday night, days from today, the School of Public Health, Blaustein, and New Jersey Public Health Association and the Child Show is screening The Invisible Cord at the Rutgers Cinema, 105 Joyce Kilmer Avenue, Piscataway. It's free, there's parking, there's popcorn. So QR code, registration is required, but hope you can attend. It'll be a great screening, and there's going to be a discussion with some public health service workers afterwards. So hope you can make it. We've had a lot of great, two great presentations this morning. Lots to think about, and lots to think about how we are going to move forward in the times that we're in and the challenges that we're facing. So to help us with that, our next speaker, TekishaDownEverette, is the Executive Vice President of the Trust for America's Health. If you're not on their mailing list, get on their mailing list. It comes out a couple of times a week or one time a week. Lots of great information that gets emailed out. In the role as Executive Vice President, she works in partnership with the Trust's President and CEO to chart and implement the organization's strategic direction, priorities, and provides counsel on current and emerging policy issues, and engages with key organizations, policymakers, and other partners to advance priorities to improve public health and promote equity. So we invite you up to the podium and look forward to hearing how you're going to guide us over the next 25 years.
All right, good afternoon. I typically like to be the speaker before lunch because your reviews are always great before lunch because I'm like, oh, she got me out on time. When you're the speaker after lunch, you have the big responsibility of keeping you awake. What a wonderful lunch. Thank you all so much for the planning of this symposium and for that excellent lunch. As mentioned, my name is TekishaDownEverette, and I am here today to talk to you about the future. And now and the future? Perfect. Okay, so I have two objectives for you all today, and that's really to provide national context around what's happening with public health and to also provide some strategies for resiliency in this challenging time and to think about our path forward. Now, you just heard my bio, but I always like to start with what the real story is, right? Because there's all these things that people love to tell in bios and love to read, but I always want to start with telling you what you should really know about me. And what you really should know about me is that I am a native Virginian, so I might say y'all, with a little drawl here and there. I'm the child of Janice and James, both of whom have gone on before me, and they are now deceased, mainly because of issues that could have been prevented. And it's definitely a part of my passion for why I'm in public health and care about health care. I am an avid traveler, so you can see that globe on here at the top. I've been to all but one continent. If you want to guess that continent I haven't been to yet, it's on the 2026 plan. So hopefully I'm going there. But mainly I travel to really observe what is happening around in different countries, different states, different cities, different places, because we grow up so often in the world we live in and only narrowly understanding the world from that lens. And there's so much gained when we have the experience of diversity in our experiences, the experiences of diversity in the people we communicate to, the systems we review and understand. I'm also a dog mom, so those little two puppies over there are actually missing me because this is like day 5 of me not being with them. So the next few days are going to be a little bit intense and crazy. Please pray for me to whatever way you pray, or keep me in your thoughts because they're going to drive me crazy. I am a professor, so I have 2 appointments, one in the Yale School of Public Health where I teach a course I designed called Advocacy and Activism in Public Health. A little bit of that I'll talk about today, or a little bit of what I tell them I'll talk about today. And I'm also a recent I'm also have an appointment at the School of Public Health, which is a new school. Global School of Global Health, not Public Health, which is a new school at Meharry, where I teach the political determinants of health, again, which will come into this. So those are all the fun things that people really want to know and like about, to hear. But the one thing I haven't mentioned yet is the number one thing that's important on this brand for me. And it's while I have all of these degrees and all this stuff that I've learned and a wealth of things that I can share with you from a different perspective, the biggest thing that's really important to me is I'm a person with lived experience. When I walk into a room, all too often, I'm the only person who's not looking at this through an academic lens or study lens, but someone who can actually talk about what it's like to have parents who have died and family members who have been suffering with preventable diseases and causes that they didn't have to have. Someone who's been on Medicaid and understands that changes that were done to Medicaid in the 80s and 90s, as well as welfare, because I was also a welfare recipient, child of a welfare recipient, how those changes impacted people's lives on a daily basis. So when I talk about this, I'm true to this. I'm not new to this, right? This is not just an academic conversation for me. It's the driver that helps me understand when people make decisions and policy that don't meet where the people are because they have no understanding of how people are living, we have huge problems in our society, and it continues to foster that. So that's the real story about who I am in my bio. Things that you're not gonna read about. Now, I will get in trouble if I don't do my 20-second commercial. I really won't, but it's also important to note that I do work for the Trust for America's Health, which is an independent, nonpartisan, nonprofit organization located in Washington, D.C., where our job is to really think about, from a research, advocacy, and policy perspective, also utilizing strategic communications, what we need to do about the public health infrastructure and the state of public health in our country. That includes the system and the public's health. So we have a national viewpoint on how we approach these, address and approach these issues. We have several research reports that we put out annually, and thank you for the commercial around our digest. We have several different digests that we do put out, and you're more than welcome to join those and sign those. They're very informative about what's happening in the national perspective and also what we're hearing from our colleagues around the country. In addition, how many students do I have? Raise your hand. Lovely. Students, we love you. We have a wonderful internship program that we have, where we have interns every season. I should call them semesters, but we think of them as seasons because we're not academic at that institution. So I encourage you to look towards that as well as an opportunity to come to DC and to intern in our various departments, and we can talk about that offline because that's just a little bit of a commercial break. But that's who we are and what we do, and why I'm here today is to talk about this. So, I'm doing so well. Thank you. I hoped you would laugh. So as public health practitioners and educators and all of the like, you all, I just want to remind you for a second that while it might feel like chaos started sometime in January, we've actually been in a chaotic way of life since 2020. We had a lot going on and continue to have a lot going on between the proliferation of chronic diseases and the increasing way that we're seeing chronic diseases trending in our society, paired with the COVID-19 pandemic, along with mpox, you just keep naming it, wildfires, extreme weather. Everything has been hitting us everywhere, all at once, all at the same time. Paired with that, we now have a measles outbreak, something we never even thought we would see again in our country. And in addition, we have a lot of misinformation, disinformation, public health being under attack because of what we call science and what other people are calling fake news. But when we understand that when we're talking about quote unquote fake and facts and different pieces of that, that we're also seeing a country that is deeply mistrusting what public health says, what public health is, and what public health does. Now, some of that's our fault. Let's own that. We're not the best commercials of our own work. In fact, I love the slide that you had before about the invisible core, because generally speaking, when public health is working well, we're invisible. have to explain what public health is to my 80-year-old aunt. And basic what I say to her is, you know how you confidently walk into that Green Turtle restaurant that you love so much? She's like, yeah, my grandson did introduce me to Green Turtle. It always goes like this, like it's somebody else who told her about it. And I said, well, you can safely go into that restaurant almost anywhere in the nation and eat without problems because someone in public health has inspected that restaurant, has made sure that it's meeting certain standards, and you, as the beneficiary of this, can just walk in without trying to figure out, well, am I gonna die today because of some sort of mishap in the kitchen? She was like, I never understood that. I was like, right, because we don't do a good job of talking about the everyday things we do that prevent people from, like people take for granted, clean water, fluoridated water, all of these things that people just take for granted that happen. You turn on the spigot, the water flows, and you can drink it in some places. We also know that there are places you can't. And we also know that that's a failure of public health, right? And policy that happened there. So in general, we understand that we have our own commercials that we need to do, but we're fighting up against a world that's consistently giving disinformation and misinformation intentionally to make us seem as though we're not doing the right thing. There's also, we're competing against what we didn't have to do a long time ago, and half of the room, maybe a third of the room will get this, and the other half will be like, I've never known a word like that. When we were growing up, a third of us, we would have to rely on the newspaper, television, or word of mouth to really get the spread of our information. But now we all have these little tiny devices that within minutes can give us information, and we're not always able to tell whether it's fact or fiction. And so you find a lot more people today are not getting their news from reputable sources. They're getting them from folks that they're seeing on TikTok. And these TikTok brilliant people who have now become like ad hoc public health practitioners are spreading information. Sometimes that's great and you want to use them as trusted messengers, but often they have a little bit of misaligned information in there, or a lot. And we're kind of beating up against that. So when I say we've been in a state of chaos since 2020, I just want to remind us, right? We've been doing this for a little bit of time here and experiencing this for a little bit of time. And yet, here's what's been going on in the last 76 days. We have a new administration who's doing a lot of work really fast in their first 76 days. Now, for people who don't know this from a political scientist perspective, the first 100 days of a presidency is most impactful and important because it sets the tone of what that president is intending to do. I think it was the Roosevelt administration that first kind of set this first 100 days piece, but those first 100 days are the most important. It's the agenda setting time, it's the framing up your administration time, it's all of those things that set out what the next 4 years are going to be. So I just want to remind you as I go over this, we are 76 days in what is supposed to be 4 years. And what I like to consistently remind people is because and though chaos is swirling all around us, we as individuals cannot respond chaotically in public health. When we do, we lose our own ground on what we know works and what we know is good and true. But just to give you a little bit of the facts, in the first 76 days, we've seen 111 executive orders, some of those dealing with eradicating health equity from the previous health equity proclamations and executive orders from the previous administration, some of them attacking diversity, equity, and inclusion, and eliminating those through a various amount of different ways. Most recently, we've seen the clawback of $31 billion worth of public health-related funds. So a lot is happening on the executive order level. There have been 29 proclamations, 27 the Miranda, and we're in the process of seeing who's going to be the heads and the leads of our key federal agencies around health and public health. So we have a confirmed secretary, a confirmed NIH director, confirmed FDA commissioner, just confirmed CMS administrator a few days ago. And last week, we also heard the reorganization was announced of what's happening around HHS, as well as the reduction in force, where the goal is to reduce HHS by 20,000 employees quite quickly. And I think last week we were about a reduction of 10,000 so far. There's some breaking news that I'm going to give you about this too in a few moments, so stay on the edge of your seats. I'm not going to give it away yet, but we're going to go there. So that's what's happening in the first 76 days, right? Meanwhile, in Congress, there are several public health programs that require reauthorizations that have not yet been done, including PAPA, which I'm not going to remember exactly all the words of PAPA, but it's our Preparedness and Hazards Act that gives us a lot of funding related to that. The Public Health and Prevention Fund, which was established in the ACA as a consistent line to deal with prevention, is slated to be eliminated. Has not gone through yet, but it's a target, is what I should say about that. There are additional work requirements being considered for public programs, such as Medicaid and SNAP, et cetera, and there are Senate groups that have been formed to reform the CDC, Senate folks to mirror the DOGE, which is Department of Government Efficiency, and also the Make America Healthy Again caucus in the House and Senate. So you're also seeing some synergy and alignment between what's happening in Congress with what's going on in the administration. And also, meanwhile, in the courts. So the courts are actually super busy right now because in reaction to some of those 100 plus executive orders, by the way, I forgot to mention, this presidency has one of the highest number of executive orders in the shortest amount of time since we've seen President Truman, which had 139 within his first 100 days. So we're on pace to beat that historical fact. There are more than 150 lawsuits and counting where people are suing or asking for temporary restraining orders in response to some of the decisions that are coming out of the Trump-Vance administration. And some of those actions, including, some of those actions, 50 plus, have been paused because what's been called, again, working while they work through the judicial system. So we're in flux. Some of the things that have come out, we don't know if it's happening yet. We're not sure if it's paused yet because it's like ping pong. What's going back and forth. And breaking news, literally just as I was sitting at the table, there's been a temporary restraining order from the from the courts stating that the clawback of the billions of dollars in the COVID public health funding has to pause in 23 states because those states filed a lawsuit, and congratulations, New Jersey is one of those 23 states. So lots going on. There's a lot of chaos and or order and or disorder, depending on how you think of all of this stuff, because I think it's orderly designed, but feeling chaotic because it's coming at a rapid pace. And while you're asking me to be here, I really don't have a crystal ball. Those aren't talents that I have to really tell you all the facts about the future. But here's what I know. All of the items that we've seen today, as I've said before, we're 76 days into what's supposed to be 4 years. So more chaos is coming. And by chaos, what I mean is, there's going to be a lot more decisions that are going to come out of the administration that a lot of us are trying to interpret and understand what the real impact is going to be, what the future of public health is going to look like, who and what will make up the CDC, SAMHSA, FDA. If we're making America healthy again, what does that actually mean on the ground, and how do we interpret that, and what's public health's role in that space? How do we think about and listen to the science and actually implement decisions based on that? What's going to happen with the measles outbreak that we're facing right now in different states, and how's that going to go? And quite frankly, what will be the opportunity for the workforce going forward? These are all questions that I wish I had a crystal ball for, because y'all would pay me and I would just sit up out here and I would sit here for the rest of however long it takes, because I would be such a big factor in the world. But we don't know. Here's what we do know. Public health has been here before. We know that this field is critical and important to the existence and continuance of this world. Period. End of the statement. One of the reasons we are able to sit in this United States and in the world, period, and see people living longer, with more mobility, maybe less sanity, and I don't mean that from a mental health perspective, but just because the world is doing a lot of things and changing, is because of public health. We have had the most wonderful advances in longevity of life, and actually, though people are living with more chronic diseases, actually living through and managing those diseases. That's because public health shows up, public health does great work, and so we know that we will continue. And I want to be very clear. My organization is nonpartisan, my statements are nonpartisan. People can feel chaos in a multitude of ways throughout many different times and ways it comes up. What we have to stay true to in the public health field is understanding our science and our evidence prevails. We know what works. When we do our jobs well, we actually know what the community needs and wants. We're actually the conduit between institutions and entities who don't understand community, who have no pulse of what's happening in terms of our communities. We are the ones that they turn to and come to. So here's what I'm going to ask you all to do. Whether you feel the state of chaos, I heard the student who stood up earlier and asked the question about uncertainty around the workforce. So whether you feel uncertain about your own job today, the job you might have tomorrow, whether all the work you've done so far has been worth it, will people understand and or value you? I want you to remember, looking to your left, right, in front, and behind you, we care about you. We actually do value what we do. We value what you do, and you have to be here when it all settles, because folks are going to be relying on you. So how do we deal with this? I call it rest, resist, and resolve. First, I want you to take care of yourself and your loved ones. If you're not spending the time that you should with them, pause and actually do it. This might be the best time to do it. It helps you to think about your sanity. I ask you to find joy in the chaos. I ask you to remember that even though chaos is all around us, we cannot respond chaotically. We must respond methodically. I ask you to stand up for public health. So take us out of those invisible spaces we live in and start having those everyday conversations that I just mirrored, that I'm having with my aunt, with your aunties, your uncles, with your loved ones, with the students on the corner, with everybody who's not in your field, making sure they understand the importance of public health in their life and globally. And then I ask you to find ways to resolve these challenges rather than complain. So we could sit around and be sad all we want to and complain all we want to, but if we're not going into action around what we see and making it clear how we are important and what the work that we do are important, it's going on deaf ears. And we can't just talk to each other in this room, right? This is not Vegas rules. I'm asking you from every conversation you've heard today and everything that I'm saying and we go on to say this afternoon, that you take it outside of this room and that you hit the streets and you make sure people understand the value of this work. I want you to increase and improve and use your skills around communication, research, and advocacy. So on communications, I have students every day ask me, how do you get through this time when it seems like people are so divisive? How do you break through? To me, it's easy. You start a conversation with values. It's real simple. If you don't see my humanity and you don't agree that I'm worthy, why would I talk to you about my particular issue? There's no value there anymore. So if you start fundamentally at core values, ensuring that people understand the core values that you share together rather than the differences between you, those core values are more important than differences. It makes it easier and simpler to move into the conversation about problems and issues. But when you start with problems and issues and people don't really understand, let me rephrase, you don't really understand if the person across from you even has a value for that issue, sees the problem the same way, or even cares about it, you miss the mark completely. You have to remember in communication and in advocacy, the conversation is less about you and 100% about the person you're speaking to who can make the decision that you need them to make. So if you're starting off the conversation based on how you understand it, rather than how they understand it and how they need to understand it, again, you're missing the mark. So let's start with putting values over issues, people over problems. If you're looking for tools and ways to do this, I encourage you to look at the Public Health Communications Collaborative, which has been in existence since 2020, and putting out key information to combat misinformation and disinformation. It started around the COVID-19 pandemic, but it's expanded more to talk about other issues and items that are happening in the field today. And if you want to deepen your skills here, because remember I asked you to increase your skills and improve them and then use them, There's the Public Health Collaborative Academy that came out, PHCC Academy, that is available for that, which is an opportunity for you to enroll in live, asynchronous and live courses online that help you actually think about how you improve your communication skills. Because like I said before, we're not our best commercial advocates, and so we have ways that we can grow there. On advocacy, I've heard a lot of people talk about, I'm not gonna say this right, but the New Jersey Association of City and County Health Officials, the NAJWA, is that how you say? NAJWA? Okay. The state version of NACHO, I barely get NACHO right. But if you're not involved in any of these organizations, you should definitely engage. There's a lot of good advocacy and statements that come out of organizations about what's happening on the ground here. I included APHA and Trust for America's Health, because if you're involved in your state APHA, you get a lot of the information that the national APHA is providing about what's happening on the national level. And I think that's the important part of my conversation with you today, is I'm trying to provide this kind of national context, not to depress you, but for you to understand that there's a meeting of the minds about what's happening locally, state, and nationally, and that you need to be engaged in understanding this stuff overall, like in every single area. One of my fun stories is that I used to work in Connecticut with a lot of public health departments. They couldn't really tell you if their funding was from federal or state for different programs. And that's quite unfortunate, because when the swift change in action comes where federal dollars are dismissed and you don't really know the difference between where the pots of money come from, you really don't know how to continue the work or whether your work will continue. And so you want to be able to actually have a little bit of understanding of how these things, how this stuff goes along. I got really excited and put the clicker down, so I need to go to the next slide. If you're also looking for, in terms of advocacy, there's some key things that you can look to for recommendations that you can adapt that come from a federal level, that you can look to see what are the opportunities to advance that work in your state and your local level. And I'm making this broad because some of you may stay in New Jersey in terms of students, and some of you may not. I'm sure all of New Jersey wants you to stay, but there might be other places you go. And so there's an opportunity to look at our blueprint that we produce every year. This is the 5th edition of it. And in the blueprint, it's designed to tell the next administration and Congress, here are opportunities that you can implement that will advance the nation's health, particularly and uplift our public health workforce. So we did a lot of, and they're all evidence-based solutions. So we did a lot of work and research to come up with these 6 areas. All 6 areas have recommendations, both to the federal government and some of them also to states, that should be implemented to do this work. And so you have, this is a tool as well that you can use in your advocacy. And I'm just giving a little heads up, is that as promised, I talked a little bit faster than I thought I would, so I'm a little bit ahead of schedule. I know we'll have some time for questions, so that's a note to both the planners and also to you to get ready if you have questions. But most importantly and significantly, we need you to tell your story. There's nothing better than a great story. I've been trying for the last 5 years to get my students out of starting conversations with data and statistics and figuring out a way to tell the story around those data and statistics while also providing them. And so I'm going to say to each of you, you have a story to tell. Some of you are researchers and you know what's happening based on the research. Some of you are public health educators and you know what your students are telling you. You know what have a pulse on what is needed and what is being said in terms of what we need to hear from public health students, what public health students need to hear and what the public needs to hear. Some of you are the students who are living different lives than everyone else, both trying to figure out how do you bridge what's happening right now in your academic life with what is ahead of you in the future. Each of you have some version of a story. I argue, stand in front of the mirror, give yourself 90 seconds, and tell the story about the most important thing to you, the most important issue you're facing. And I say 90 seconds because that's typically in any large high-rise building, the time it takes to get from the ground floor to the top floor. And that's about the time you have when you're meeting with a policymaker to convince them that you have something to say. So you want to get better, you want to get really good at telling your story. We need you to tell your story. In fact, we need lots of stories in DC because you can't do the advocacy work there without having the backup and the support of what's happening on the ground. So now we're back to my crystal ball. We want to talk about the future of what's next. And here's what I have to say about that. I believe we're going to see a stronger, more resilient, better educated because we're better at doing this, public health field going forward. That field's going to look a little bit different between how the agencies are set up, who comprises that work, because there are two things that are simultaneously happening. A federal desire to reduce the workforce and a huge influx of students coming into public health because they see the importance and the need. So we're going to figure out how to reconcile those two things over the next few years, meaning decade, on how we right-size and become more effective and efficient at what we do, regardless of where it is. Public health will remain the critical key in changing the health trajectory of our country. If in fact we're serious about making America healthy again, I don't know when it was before any more than now, but if we're serious about that, it's going to take the hands of each and every one of you in this room and many more of us across the country. I'm a little sarcastic, so when I say the point that I don't know when it was healthier before, I definitely know when it was healthier before. But I think that there are a lot of challenges we have systematically that we have to work together to get through that, to get to that state. I also think what's next is that based on conversations like the ones we're having today, there will be many more people who are standing up to tell their story about what's going on and what's important in our nation and how we need to actually make change from an advocacy perspective in our space. And when I say advocacy, let me be clear. I am not asking folks to lobby. I am simply telling you, you have access to people who make policy and you have a story to tell them, you should tell them. And you should make sure they know it. Does it always mean that people in power will make the choices that we think they should? You've got a 50-50 chance on that. But we can definitely be assured that if our voices are not heard and our voices are not a part of the problem, part of the conversation and a part of the solution, that we are the ones who will be on the table. So I'm asking you, become an ingredient on the menu. And I believe that's going to be the key thing that changes us going forward. My last point here before I hand the mic to you for your Q&A is to remember, we've been here before. We've lived through chaos. We're resilient as a field. We'll be here tomorrow. Thank you.